All right. Good morning, rhinos. Dr. FJ. We got a couple questions here. One is on knee decompression. No, I do not do that. Um, I've heard the results are very good. I'm sure it's all about getting the right patients. I would get on Telegram and ask Dr. Troy. I know he does well with that. But I've heard that, yeah, for the right patients, the results are really, really good. And if your marketing's dialed, then it can be quite lucrative for you. So yeah, sorry though. I mean, I'm sure you do it just like regular decompression. It's just all about bringing the right people in and then communicating it and getting them to commit and delivering it. So yeah, I would get on Telegram and ask Dr. Troy. I know he does it and he does quite well with it. Um, and then you can see if anyone else is doing it. So we got another question. One of the things that I've questioned on is we go over a plan with patients. We still have a lot that asks if they can pay by the visit because of this in this area. Almost all chiros do that. Of course, when they do that after 5, 6 visits, yep, they feel good and they're done, which is, I mean, it's not ideal, but then you know they're coming back on what to say. Also, many chiros around here have never done plans. Yeah, that's common in a lot of probably a smaller town. Yeah, they let patients dictate care. Yeah, I mean, I would say, first and second visit, first visit, what we do here is a little different. We want to focus on corrective care and really stabilizing the spine. Because, if we just get you out of pain, it's going to come back. And then I would really focus on the degeneration and just explaining to them if we don't change it and stabilize it, you may feel better for weeks, months, or even years, but it's going to continue to deteriorate. And then eventually, you're gonna, it's gonna be too far gone, and you're gonna stop responding, or you're gonna need a whole lot of care. Um, so that would be my biggest, yeah, is really just communicating the effects of what happens alignment wise, really getting into alignment and not just pain and explaining uh if it's not corrected, it's going to continue to deteriorate. And yeah, you'll feel better, but at some point, it's going to need a whole lot more care. And it's going to take a lot more time and be a lot more expensive. And sometimes it's just too far gone. And now is a great time. So if you can really, the cost of not getting it, stabilized and not getting regular care, and then the benefit of doing it, really getting into that will be big. As far as I'm curious, the discounts you're giving because I would make sure you're prepay, and I offer per visit, and I do have people that do it, and that's fine. And yeah, lots of times it's exactly like you said, 5, 6 visits. When you get to that 5 or 6 visit and they're feeling great, do your best to talk them into coming in, twice a month or once a month. Some will, some won't, and see what will, and that way you can keep them somewhat regular. And some will do it and they'll be really good patients for years and they'll do the twice a month forever. And that's, you'd like to start them on a plan, but at least it's something and you're helping them. Uh, I would do, for your prepay, I would make sure it's at least 20%, 20, 25%, or 30% usually is a big enough discount where it gets people to do the prepay over the per visit. I always offer the per visit, and just make sure that that's an amount that you're happy with. Whatever it is, 50, 60, 80, $100 a visit, so that you're happy to give that adjustment for that. And it's nice to have some per visits. Obviously, you don't want everyone to do that. But yeah, really communicating what you're doing with the regular adjustments because people don't understand that, I'm just going in to give them $60 when I feel great. But having objective, whether it's x-rays or posture or range of motion or Titron scans, having some objective measurements is really nice. If nothing else, just talk about stabilizing the spine and getting the body to move more effectively. The flexion extension x-rays are easy things to improve, um, depending on what kind of care you're doing. And really communicating that if you don't correct it, yeah, 3 adjustments, you may be out of pain, but you see this here, this is going to continue. You can see this degeneration here, or can you see the next, there's no curve here, or can you see this head tilt there? Well, that's going to continue to deteriorate. That's why I really like the four phases of degeneration in the ROF, so you can show them. And then if, and some people, they don't have a whole lot of pain till it's, really bad. And then at that point, the amount of care you need, it's very hard to stabilize the spine. It's limited on what we can do. You're more fragile, you're more frail. Just be real with them, and be upfront and be like, hey, if, as long as you understand, I'm happy to give you some adjustments, but this is, what you're choosing, as long as you understand that. So I'd really make sure you communicate the benefits of the adjustments and the cost, the what happens if they don't get adjusted. It's going to continue to deteriorate, it's going to get worse, the connective tissue is going to wear down, and that's really the limiting factor, is that connective tissue. And when that connective tissue gets really arthritic and really degenerative, it's a lot more limited on what we can do. And sometimes, it's too late and there's not a whole lot we can do at that point. So explaining that to people, and then most of the people who can, a lot of people do it, not everyone, but at least they know. Be like, you just, as long as you know you're not correcting it, and then there's a good chance, eventually, you'll stop responding, or you'll need more and more and more visits to get out of pain. And so as long as they get that, they understand that the connective tissue is going to continue to degenerate and yada, yada, yada. Just really go through that and take your time and explain that to people. And then some people will still do it, but at least they know now. And they'll come back in a few years, and instead of 5, 6 visits to get out of pain, it's going to be 7, 8, 9, 10, 11, 12, 13, 12, and you can tell them, like, this is what I was warning you about. It's gotten really bad. And now you got to come in once a week, for the rest of your life. And it's limited on how much progress we can get because there's just so much damage. So communicating the degenerative damage that occurs, uh, and that's the biggest thing. I tell some people go out, they're out of alignment for years before they feel anything, but that connective tissue, those ligaments, tendons, joints, they're slowly, quietly deteriorating. And we can get you in alignment, uh, lots of times pretty quickly. But now those tissues have to heal. And if they've been degenerating for decades, that can take a long time, and it can need a lot. And you're not going to hold the adjustments as long. You're not going to stabilize as easily, and you're going to be a lot more fragile. So going through that with each person and really explaining the benefit and the cost of the choices, and then let them choose. But also just having a good discount for the one time. Like if it's only 10%, that might be part of your problem too. It'd be interesting to know the exact details. So I hope this helps, but I would start there, just going through the degeneration and whatnot, and explaining the benefit. But yeah, I mean, day one, you want to be differentiating yourself from everyone else. We specialize in corrective care. We really want to stabilize the spine, change how it's functioning. That's going to take some time. A lot of people, it's 3, 4 adjustments. You might be out of pain, but that comes at a cost because eventually that will quit working. And then you have all this damage that you could have avoided if you'd have come in regularly. And lots of times nobody's ever communicated that to people. And that's all we want to do is let you know what's actually happening. So you're upfront, but you're friendly. You're not scared, just terrifying people. This is worse than cancer. You're not doing any of that nonsense. As far as part-time staff, it depends. I like Indeed. I've gotten decent people off it. You gotta pay more now than ever before, though. So I would just be curious what you were offering, like how much you were willing to pay. That would probably be my guess as to why you were wasting a lot of money on there. That's the only place I've gotten quality people from is Indeed, but you got to pay a lot. And so trying to use AI as much as possible, I think, for things, and then having less people but then paying them more is probably going to be the future, from what I've seen. Because yeah, I mean, I'm starting now. 24 an hour is, I think, and I'm in a small little Midwest town. Median household income's just a little over 50,000, so it's not like a really expensive area. And anything less than that, and we just got nothing. So if you want to get someone decent, that's probably why you got nothing from Indeed, I'm guessing. So yeah, let me know what kind of discounts you're offering, and what exact techniques you're doing, and we could go through that next time, you know, help you with this. But it's an issue as long as I think the baseline goal would be over 50% of people right away are committing to care. If you can get in that 60-70%, that's really nice, depending on how many new patients you're getting and what kind of new patients. It's a little different. Um, but yeah, if you got like seven, if you got most people are picking per visit, then something's being missed. You're not communicating the benefits. You're not differentiating yourself. You're not communicating the costs of what happens when you don't get regular care. You know, if you just play the pain game, that's lots of times fine when your body's young, but those connective tissues are going to degenerate. They're going to deteriorate, and it's become more and more limited as that gets worse and worse as to what we can actually do. So as long as you're communicating all of that, then you should be fine. But let me know. Let me know. I hope this helps. And yeah, with Indeed, I'm curious what you were offering to pay and what how you know how expensive your community is, um, because that would be my guess there. And for yeah, the knee decompression, get on Telegram and talk to some of the docs who are doing it every day. But I've heard the results for the right people are great. So I hope this helps, guys. Again. Let me know if you have any follow-up questions, especially to these per visit plans. Um, and yeah, that's pretty common. A lot of chiros just let people dictate care. And I have a per visit option. I do have people that just pay, you know, just do pain, but I make sure they know and they understand, like, okay, we're not stabilizing, we're not seeing you regularly. This does come at a cost to you, and this is what that cost is. And as long as you're okay with it, no problem. And then yeah, at that once they are out of pain, you know, if you try to keep them coming in twice a week, you're probably going to lose them. And just say, hey, we're not doing anything structural or regular, you know, anything objective, which is just about pain. So you're feeling good. All right, why don't you do twice a month now? And let's go from there. And just, you know, you're playing the pain game, but at least you're keeping them somewhat regular. So you're going to help them more. You're getting some recurring revenue, and it's better that way. So yeah, let me know any follow-up questions to that. But yeah, the digit, and I would have a picture of the four phases of degeneration. It's just a nice way to show people what happens to the connective tissue. It's not the bone. And yeah, the bones are going to get arthritic and you see that growth, but it's those discs and those joints that now can't move because they're so destroyed. Um, and now we can't, and depending on the technique, now it's like, okay, when we're not doing diversified or Gonstead, we got to move to a different technique because your body's so far gone, potentially, right? So depending on what techniques you're doing, what you're recommending, we could get a little more detailed. So let me know in a month or something, or we could set up a little video chat, maybe record it, help everybody learn, and go from there. So, all right, guys, appreciate it. Thanks for the questions. Any other questions, let me know. Have a great month and keep charging.